Next, I'd like to recognize Senator Bingaman. I don't anybody who's spent more time in healthcare this Congress, and the senator from Mexico. Senator Bingaman, as we all know, is not only a senior member of this committee, but also on the HELP committee, and spent all those weeks, hours working on amendments offered. The committee knows the subject so very, very well, and on top of that, is one of the group of six, so-called, and spent hours and hours. I think we had 63 meetings, if I'm not mistaken. So Senator, just thank you for all your diligent work and getting down the details and helping us figure out in a practical, pragmatic way what's the right thing to do here. Thank you.
Well, thank you very much, Mr. Chairman, and you're the one that ought to be getting the accolades today, and you are to a substantial extent. The phrase that I've heard more and more members repeat here is extraordinary effort, and I endorse that. I think you have made an extraordinary effort to get us to this point, and I very much appreciate it. Over a very long time, Senator Enzi and Senator Roberts and Senator Hatch and I all serve on the two committees, this committee and the HELP committee, and we all spent a lot of time. I think we went on for, I don't know how many weeks of markup over there, but it was quite a while.
I heard 3. Is that right?
Years, Senator Roberts says, but it was a while. And of course, as you point out, we've spent hundreds of hours trying to get this legislation in a form that we could move ahead here in the committee, working with yourself and Senator Conrad, Senator Grassley, Senator Enzi, and Senator Snowe. So I very much do appreciate your leadership. I think this the broad construct of this legislation accomplishes the objectives we all want to see accomplished. That is, it protects those things that work in our system. It tries to reform the things that don't work, and there are many of those. It reduces the growth in cost of health care going forward, which is an extremely important objective. And it provides affordable coverage to an awful lot of Americans who currently have no coverage. And that, I think, is much to be desired. In my home state of New Mexico, we have many of these problems in spades. Nowhere in the country, in my view, is the problem more serious. We continue to be the second most uninsured state in the nation. We have the highest percentage of workers who are uninsured of any state in the nation. Health insurance premiums continue to rise at an unsustainable rate. The projection is that New Mexico will experience the greatest increase in health insurance premiums in the nation over the next decade if nothing is done in the nature of the reforms contained in this legislation. The average premium for a family of 4 in New Mexico was $6,000 in the year 2000. By 2006, the rate had almost doubled to $11,000. By 2016, the amount is expected to rise even more to an astonishing $28,000. So we have a serious issue that needs addressing. Mr. Chairman, I will not go into the detail of various amendments that I would like to see us adopt. I want to just endorse the comments that others have made about the need to be sure that the health care we're requiring people to obtain is affordable, and you have moved in that direction very substantially. And in this bill and in the modified version of this bill, which you're planning to present to the committee, I hope we can do more in that regard. I also hope we can do something to increase competition in the sale of health insurance in the country. I know the co-op proposal, which is in the mark that's before us today, has promise and may well accomplish that objective. I have thought that a more straightforward public option, which would be organized on a level playing field so that you would have fair competition between the public nonprofit entity and private insurance companies, would be an even better way to go. So I hope that we can make that improvement as we go forward. I do think that Senator Snowe, I think, put it well by saying that the seriousness of this issue requires that we undertake a painstaking process here in the Congress, and you have done that. And this markup promises to be a painstaking process as well. And I hope that the end result is one that solves many of these problems that have plagued the country for many decades now, and puts us on a road to a much healthier and more sustainable situation in the country. So again, my compliments to you, and I look forward to working with you through this markup and through consideration of this legislation in the full Senate.
Thank you, Senator.